go. Okay. So welcome everyone. I'm Melissa Chalker, the Executive Director of the New Jersey Foundation for Aging, and I'm really grateful for all of you for joining us today for our third webinar in this series on learning from COVID-19. And we have yet again another wonderful panel to share some information with us. Just a few reminders before we do get started. You've all joined us in mute, and we ask that you use the chat box if you have problems or questions, and in particular for questions, because we will be after the presentations doing a Q&A. And so if you have questions for our presenters, please do put them in the chat box, and we'll be asking them of the presenters when we get to that portion of the program. So really, again, grateful for all of you joining us today for this webinar. And it is being recorded, and so we will share the recording with everyone after the webinar is over, as well as a follow-up email that will include any other materials that the panelists have wanted to share with you, and any follow-up that we can offer from today's program. So we're really looking forward to it. Wanted to mention also that this webinar series has been brought to you by two sponsors, Archer Law Offices, an elder law attorney firm, and our friends at AARP New Jersey. So we're really thankful for their partnership in this and allowing us to bring this series together. And so before we get to our presentations, I'd like to just offer a few words from our sponsors. And so we do have with us this morning Tom Callahan from the Archer Law Office. And Tom, if you'd like to share a few words with us about the firm, you can go ahead and unmute yourself.
Sure, thank you. As Melissa said, my name is Tom Callahan from Archer Law Office. We're a law firm dedicated to serving the elderly and their caregivers in New Jersey, Pennsylvania, and New York. We have 4 offices in Hamilton, New Jersey, Jamesburg, Moorestown, and in Bridgewater. We are unique because we have our own in-house Medicaid department, as well as the department that I run, the Senior Living Resource Department. We're dedicated to making sure that anybody who needs help for a senior or elder loved one can find the help that they need at an affordable price.
Excellent. Thank you so much, Tom. I appreciate that. So you can see on your screen some information about Archer Law Office, as well as their contact information, which we can also make available in our follow-up email in case you'd like to reach out to them. And again, we're extremely grateful for the partnership of Carl and Tom and their team in helping us bring this together. And so do reach out to them if you have any of the needs there. And then also we do have a quick word from our friends at AARP via video. So I'm just going to make sure that our settings are correct for playing that so we get that good. Here we go.
Scams or fraud can happen to anyone and can increase during unsettled times. The AARP Fraud Watch Network helpline is here for you. Our trained fraud specialists can help you know what to do next and how to avoid scams in the future. Protect what's yours. Contact the AARP Fraud Watch Network helpline today.
Okay, so there we go. Thank you again to AARP New Jersey and to Carl Archer Law for their sponsorship of this series. And today we have with us, as I said, a really great panel to share with you some terrific information that will be very useful during the continuation of dealing with COVID-19. So first we have with us Frank Winter from CMS to talk to us a little bit about Medicare and what those, any changes to benefits or updates or information that is going to be useful to you today. So, and then that'll be followed by Charles Clarkson from the Senior Medicare Patrol, and then finally we'll do a Q&A there, and then finally we'll hear from Christine Newman at AARP New Jersey. So with that, Frank, I'm going to turn it to you. So I'm going to go ahead and mute myself and let you share your screen and take it away.
Thank you, and thank you to the Foundation for Aging for inviting me to talk to you this afternoon. Hope everyone's having a good Friday. I'm going to talk to you a little bit about Medicare during this unique time with the COVID-19 emergency and how things are working. And I'm going to start a little bit with some basics just so we're all on the same page. Let's see. Slides are not advancing. Oh, there we go. So just so everyone's on the same page, of course, Medicare is a program, provides health insurance for folks 65 and older, those under 65 with certain disabilities, and folks with end-stage kidney disease. And during this time of COVID, it's important to note pretty much our entire Medicare population, is made up of high-risk groups, or at high risk if they contract COVID-19. And so it's had a big effect on the populations that we serve. There are 4 parts of Medicare. Part A, the hospital insurance, the inpatient coverage. Part B, we sometimes call just medical insurance or outpatient coverage. So physician services, medical testing, et cetera, medical supplies. There's the prescription drug coverage, which is Medicare Part D. And there's what we also call sometimes Medicare Part C or Medicare Advantage. A lot of Medicare beneficiaries, closing in on 40%, get their coverage from private health plans that offer the same benefits as original Medicare. Our partners at Social Security handle enrollment into the original parts of Medicare, except for those who are railroad retirees who go through the Railroad Retirement Board. And there's a small role also for the Office of Personnel Management for federal employees. But we handle the rest at the Centers for Medicare and Medicaid Services. So we handle the benefit side, the coverage side of Medicare. And how people have been receiving services right now is, as I think folks know, is very different. And I'm going to talk a lot about that. But also how people apply for Medicare has been impacted. And a lot of folks are in a position now of needing health insurance also because they may have lost their job, which is having a big impact on Medicare, but also other health insurance programs, some of which at CMS we're also involved with administering. So during the current emergency, the local Social Security offices are not open. They are accepting phone calls, so you can still reach the staff who work at their offices. Like us, by and large, they're working from home. But for some time, Social Security has really been encouraging people to apply online for Social Security. They have great resources for doing that. So that's an option. They're also allowing folks to apply by mail or fax, and there's some detailed information on their website about how you can do that during this time. If you're applying for the first time, of course, though, you can apply through the website, or if you're trying to add Part B, which a lot of folks are trying to do, because many times when people are working past the age of 65, they take Medicare Part A because there's no premium associated with it, but they decline Part B because they don't want to pay the Part B premium while they have, coverage from their employment or from their spouse's employment. But a lot of people, of course, unfortunately have lost jobs, either temporarily or permanently due to the current crisis. And so they're looking to add Medicare Part B, but there's that problem. A lot of folks are very comfortable using online services, but some folks, would have been the folks who would have made an appointment come in the local office. And so now they have to navigate applying online, but they still can reach the folks working at their local office. They just can't go into the office. And there's some information on that at the end of my presentation. So this is just some basic information about when people can enroll in Medicare. For those who are 65 and receiving Social Security benefits, it's, they'll, get the card in the mail. They can decline Medicare Part B if they still have coverage from their employment or their spouse's employment. They may want to do that. The information is mailed 3 months before the 65th birthday for the person, and they have a extended enrollment period that includes 3 months before their 65th birthday, the birthday month, and 3 months after to enroll. Because we also have a population of folks who were creeping up on their 65th birthday, and now this crisis has been going on now for several months. And Social Security has told us that they're actually a little concerned that they haven't been busier because they know a lot of people have lost coverage through employment. They know some people are still aging into Medicare. And definitely some of those folks are calling their offices. It's not that they're not busy and reaching them while they're working from home, but they're not kind of as busy. They're not seeing as many applications, or at least as of the last I heard from my colleagues at SSA maybe about a month ago. They weren't really seeing as many folks applying as they thought. And I think that may be because some folks are having a wait and see attitude. This may be over soon. Now we're starting, I think, to feel like maybe it won't be over soon, but I think definitely during the first couple of months of folks being at home, I think some people were hopeful, oh, maybe in a month or two we'll be out, so I'll be able to return to my work. I won't need to sign up for Medicare Part B, or I can continue to delay it. I don't want to make a decision about whether to get Medicare Part B right now. Maybe I've extended my coverage through COBRA. The problem with that is if you extend your coverage through COBRA, it doesn't protect you from, there's a penalty for signing up late for Medicare Part B, and COBRA coverage is not considered the same as employer coverage for that purpose. So you'd be penalized eventually for not signing up for Medicare Part B. But some people may feel, hey, I've extended my coverage to COBRA, or I've taken care in some other way of being covered or not, for the next month or two, and then I'll figure out my Medicare. But now, this has been going on for a while, and it's important for people, if they're approaching the age of 65, they just passed that point and they haven't signed up yet. Or if they, just lost their coverage through employment and they're, have been Medicare eligible, that they start to make some decisions about this. You have to take action to enroll in Medicare when it's not automatic. So for some folks who also may be making putting off deciding whether to get their Social Security retirement benefits because they think I might return to work in a month or two, then their Medicare is not going to be automatic. And eventually, if they don't sign up, they would be penalized for not signing up for Medicare. It's a 10% higher premium for not signing up for Medicare Part B for each year, basically, that you don't sign up. There's also a penalty for not having prescription drug coverage and signing up for Medicare Part D. So it's important to get moving on these decisions. In terms of enrolling in A and B, Social Security, it's very timely. I'm sure they were working on this before COVID, but they have just upgraded their portal. It's similar to what we've done in Medicare with our mymedicare.gov site that we have, where people can check their Medicare benefits and statements online, order replacement Medicare cards, et cetera. We upgraded that, I think about a year ago, so that it's more friendly for mobile devices. So Social Security just upgraded their portal to kind of reach those same objectives. As I mentioned, the local offices are temporarily closed, but their staff can be reached by phone. And I believe at the end of the slide, my resources page has the information about how you can do that. So I just wanted to mention, we have a variety of enrollment periods in the Medicare program where people can sign up and get coverage. These enrollment periods that are sort of happen on a sort of regular basis during the year, they're not going on right now, but there are special enrollment periods that you can get for special circumstances. So if you lose your employer coverage, you can get a special enrollment period. And again, you may get your initial enrollment period if you're just aging into Medicare now. So this is an opportunity for people, again, to add that coverage who may need it. This goes through the initial enrollment period as people turn 65. So, for those who have turned 65 during this pandemic, it's a good time to take action and make decisions about their Medicare. If for some reason COVID-19 and some of the confusion around it, et cetera, prevented someone from taking advantage of one of these enrollment periods, it's possible to get a special enrollment period, but that's only for a limited time basis. So, if you know someone who missed their opportunity to sign up for prescription drug coverage, for example, for Medicare Part D, because they didn't know where to go because things were shut down, they would have normally maybe called their health insurance counseling assistance program, but they weren't sure if they were open, something like that. they should act right away, reach out to 1-800-MEDICARE and ask about special enrollment periods, or if they miss their opportunity to sign up for Part A or B, it's a little, less likely that they're going to, get a special enrollment period, but it's worth at this point reaching out to Social Security and asking them about that. Each year we have what we call the annual enrollment period for Part C and Part D. So that's coming up in October. The big thing is for this year is we're expecting it to be virtual because, there's a lot of talk about a second wave potentially of COVID-19 in the fall. It's unlikely that there'll be a vaccine this year. And so, with our at-risk population, instead of doing the type of outreach events and in-person enrollment that we usually provide through the health insurance counseling assistance programs, SHIP programs across the country, state health insurance assistance programs across the country, and through events that we have with the general public, it's going to be virtual. So we're going to do a lot more with online promotion. We're going to do, I'm sure, advertising to let people know. We hope our partners get the word out because some people may have missed an opportunity to enroll and may need to use the fall enrollment period because they're not eligible for a special enrollment period before then. Some people may need to make changes to their coverage as every year. We want people to review their coverage. But this year it's going to be more virtual. People will probably be getting assistance over the phone, over the computer. And so that's something to look out for. The general enrollment period, if you missed your opportunity to sign up for Part A and Part B when you're initially eligible, you may have to wait until the next general enrollment period, which is why it's important that people take action now if they're aging into Medicare, and reach out through one of those methods I mentioned, because that general enrollment period is only from January through March 31st of each year, and your coverage doesn't begin until July 1st. So, if someone missed the general enrollment period or missed, actually, if let's say their initial enrollment period ended March 31st and they realized in April, oh, I should have signed up. They don't really qualify for special enrollment period. They're going to have to wait over a year for their coverage to start under Part A and Part B. They're going to have to wait for that next general enrollment period from January 31st the next year, and their coverage won't start until July. They'll also, potentially, if they don't have other coverage through their employment or their spouse's employment, have a penalty. So there is a special enrollment period for those folks who lose group health coverage, and a lot of people, again, have lost that coverage due to the current pandemic. And I think some of them may be thinking, well, maybe I'll get my coverage back within a few months. So they may be waiting out this. You get an 8-month period to sign up for coverage, sign up for Medicare in Part A and Part B if you lose your employer coverage. But it's important not to miss that opportunity or make the mistake of adding COBRA and, not enrolling into Medicare during that 8-month period of time, because COBRA won't protect you from penalties later for signing up for Medicare late. So it might be a solution if you just lost your coverage and you're like, I want to wait and see. I think I'm going to get a job back in a couple of months. You could pay for COBRA. It's pretty expensive, but you could pay for COBRA and then decide to enroll in Medicare later. But you have to enroll within that 8-month period. But I think a lot of people are in a holding period right now. When is the economy going to reopen? And as of now, we're not offering, or Social Security is not offering, any flexibility on that particular, 8-month time period. So something to be aware of. Of course, once you enroll, you have to make decisions about your coverage. Do you want original Medicare? Do you want Medicare Advantage? And I'm not going to go through, I mentioned, just so we're all on the same page, what Part A, some basics about what Part A covers, what Part B coverage covers. But there's some things right now that are in the spotlight, of course, because of the issues relating to COVID-19. There have been a lot of outbreaks and issues at skilled nursing facilities and long-term care facilities. Also, a lot of hospitals, particularly in New York and New Jersey, and now this is happening, I think, in some other states, they tried to clear the deck of a lot of their patients, inpatients, to make room for the fact that they would have a tremendous number of patients with COVID-19. So they're trying to release those patients from the hospital and do it quickly. And as part of our emergency flexibilities, and this applies in other emergencies as well, it's not automatic, but if the president declares an emergency and the Secretary of Health and Human Services essentially agrees with that and says it's a health emergency, could be a hurricane, even something like that, we have certain flexibilities. One of them is to waive the 3-day stay requirement. Normally, someone would have to be as an inpatient in the hospital for 3 days before they would be eligible for to stay in a skilled nursing facility and get rehabilitation. So, if you broke your hip or something, you needed rehabilitation, had a stroke, etc. This isn't long-term care; it's a stay in the skilled nursing facility. So during this emergency, that 3-day stay requirement was waived. There also is generally a maximum of 100 days that someone could be in a skilled nursing facility during a benefit period. And a benefit period ends essentially when you've been out of the hospital and out of a skilled nursing facility for 60 days in a row. During this emergency, we've also waived that, but not in all circumstances. It has to be, there's an issue relating to COVID that requires you to be longer, stay longer in the skilled nursing facility. And so these are some significant changes in terms of how that benefit works under Medicare, addressing the pandemic, and that some cases it may be necessary for people during this emergency to stay longer in a skilled nursing facility. And also in some cases it may be necessary for hospitals to have someone sort of check out of the hospital and go into a skilled nursing facility so that the hospitals can more effectively make room for some of the other patients. Obviously, that critical need is much less in New York and New Jersey now that cases have gone down, but this continues to be an emergency, considered an emergency across the country. So those flexibilities are still available. As saying, certainly caregivers, advocates should be aware of, because normally you wouldn't have that opportunity to arrange for skilled nursing facility care if you were only an inpatient in the hospital for a day or two. Now, so that was addressing a little bit Part A and what's different. There are a lot of other changes I should mention on the facility side. There's this concept of a hospital without walls. So the idea, a lot of folks know about these field hospitals that were set up in New York, New Jersey. Now, some of them I think are being set up in Texas, in other states that are seeing increases. But essentially, we needed to find a way to pay facilities for care provided that's not physically in the hospital, because our laws generally require you to only, the Medicare will only pay for services in a facility. So essentially we had all kinds of changes to make it easier for clinicians to come in, doctors, nurses from across the country, and Medicare to be billed for their services so they could get enrolled quickly. Also so that hospitals could bill for services provided outside of the hospital, a field hospital, but also to let hospitals provide out.
Sorry.
Oh, sorry. Am I running out of time? Sorry.
No. I didn't mean to interrupt you. I think you froze. So whatever the last thing you said was, if you could just repeat that in case folks didn't hear.
Oh, okay. Sorry about that. So there are a lot of changes on the Part B side relating to coverage. So physician services, therapy services, physical therapy, occupational therapy, speech therapy, mental health services, and also the authorization for services like home health that are usually done by Part B providers. So physicians usually, would authorize home health services or order other services for someone. There are a lot of changes. Now, I'm going to quickly run through some of those temporary changes. Although with telehealth, it's been so successful, and clinicians have so quickly adapted. Some who, there were definitely physicians, particularly, Medicare's rules really restricted telehealth to certain substance misuse services, which was actually a new benefit this year, and then also mostly to services in underserved areas like rural areas or certain underserved urban areas. And the big change is because, of course, people want to physically distance. They don't want to go into a waiting room. It's not necessarily so safe to go in a waiting room where there may be, if you're a patient at high risk, where there are folks who may have COVID or the flu, et cetera, at this time. So people and also physician offices didn't feel they had necessarily the safeguards and the personal protective equipment to treat everybody the same way that maybe they would be able to be treated in an outpatient emergency room where you could separate the COVID patients or potential COVID patients from others. So, there was a very quick uptake of physician offices and other providers who wanted to be able to learn quickly and that didn't have a history of providing telemedicine services that wanted to do so, and telehealth services that wanted to do so. So it's been very successful. So there's a lot of talk about extending the availability of some of these services. One part of it is that COVID-19 and really there's some risks associated with it may even extend past whenever it's not considered an emergency anymore. We don't know if there's going to be a vaccine. We don't know how long that vaccine is going to be good for. We don't know exactly what's going to happen. There's also an increased awareness, I think now, of how physical distancing relates to things like influenza that, maybe, obviously we may not all continue with these practices of physical distancing and wearing masks, but maybe some things could be incorporated. Maybe during flu season, it would be a good idea for high-risk Medicare beneficiaries to be able to have a check-in with their doctor virtually rather than going into the office. So there's talk about extending some of these flexibilities for telehealth. And we've been taking comments and feedback, certainly from clinicians, about that. But some of these changes, really are to allow a wide variety of visits, office visits that would normally be provided in person via telehealth. And initially, we provided flexibility and required audio and video, but now many of these services were allowing just phone calls, just audio, or it could be audio over the computer as well. Because some Medicare beneficiaries don't have video capabilities. We waived limitations on the types of clinical practitioners that could provide them. Initially, we were looking at physicians by and large and nurse practitioners, but that was extended to physical therapists, occupational therapists, speech language pathologists. And we received a lot of feedback, a lot of concerns about as people are isolated and at risk, mental health becomes a concern. Also, those who have substance misuse problems. So, audio-only services were extended to address behavioral health services, patient education services. So there's a lot of coverage. Some of this will likely go away after the emergency. Officially now, all of it will go away, but we are really considering extending some telehealth beyond this emergency. Now, you're going to hear from my colleague, Charles Clarkson. I think that there are risks whenever we provide coverage for something that's new. There are new inventive ways of committing fraud and abuse and vulnerability to our programs. If the services are beneficial to Medicare beneficiaries, we still want to cover those services and allow them to be provided so people can benefit from it. But it does present some new challenges for us and some areas in which we really would like Medicare beneficiaries to be vigilant, of suspicious services and of people who are contacting them out of the blue to offer services for them. Because of telehealth and because people aren't going into the offices, many physician offices are either only doing preventive services in the office or are closed. We're also allowing a lot of services to be authorized, like home health services, to be authorized without a face-to-face physical visit. And that's great during the current emergency, but it does prevent vulnerabilities. We instituted that as a fraud and abuse prevention measure, the requirement for face-to-face visits for the ordering of certain services. Because what we found was that sometimes services would be ordered by out-of-state providers for hundreds or even thousands of beneficiaries that were not legitimate, because people would, it's identity theft. People, get a hold of someone's number, and one check on that is to say, oh, it has to be face-to-face. So if that's not documented in the record that there was a face-to-face visit, then the system blocks the claim. So there are some concerns with this, but it's also been worked out really well, I think, in allowing people to get some of the medical services they need. A lot of people also have questions about COVID-19 coverage. Medicare covers the lab tests, including antibody tests for those who are interested, no out-of-pocket costs. Medicare covers all medically necessary hospitalizations, including if you're diagnosed with COVID-19 and might otherwise have been discharged, but you have to stay in the hospital under quarantine. So in some cases, the hospital would normally release someone, but they say we really don't want to release them because they are still contagious. In a lot of cases, they require someone to have 2 negative tests for COVID-19 over a few days in order to, be considered not contagious anymore. There's no vaccine for COVID-19. When it's available, it's going to be covered under Medicare Part B. Most new vaccines are covered under Medicare Part D. Requires a statutory rule for, one to be covered under Medicare Part B. And that was part of the recent law that was passed to extend certain services and coverage relating to COVID. So just as an FYI, it's going to be one of the few vaccines like the flu vaccine, pneumococcal pneumonia, and hepatitis B vaccine to be covered under Part B. Beneficiaries who have Medicare Advantage plans have access to the same benefits. We allow but do not require the plans to waive cost sharing for COVID-19 lab tests. So someone's cost could be different under the Medicare health plans. Many plans have taken advantage of flexibilities we've given them to offer the same sorts of telehealth services and also extend benefits like meal delivery or meal transport services during the emergency. The prescription drug coverage under Medicare, I wanted to mention, I sort of touched on this earlier, that there's sometimes special enrollment periods. Enrollment for Medicare Part D, the prescription drug coverage, and also for the Medicare health plans, that's really handled by CMS. Remember, A and B are handled by Social Security. CMS, 1-800-Medicare, and the health plans themselves, who are, have a contract with CMS, as well as our state health insurance assistance programs, they will enroll people in Part C and D. So it's a little bit different to get drug coverage to enroll in a health plan. And there are different rules sometimes relating to special enrollment periods and who qualifies. As I mentioned earlier, loss of coverage leads someone to get a special enrollment period. For Part D, it's a shorter period of time. It's a 60-day period of time. If you lose creditable coverage, where you'd get creditable drug coverage to sign up for a Part D prescription drug plan. There are some loopholes. So having been enrolled in a state pharmaceutical assistance program, like PAAD in New Jersey, gets you a special enrollment period for when you first enroll, and then once a year. So that can be if someone needs to make a change during the year. That can be important, but also there's a COVID-19 special enrollment period. It's about to expire, so if folks are interested in this, if they feel something happened during the first couple months where they weren't sure how to enroll in coverage and they needed it under Part C or D, and it interfered with an enrollment period that would have been available for them, they might be able to get that still. And folks could call 1-800-Medicare about that if they have questions. And the same would apply for Medicare Advantage plans for people who get their coverage through a health plan. Let's see. For Medicare Advantage, they are not allowed to charge copayments, deductibles, or coinsurance for the diagnostic clinical lab tests for COVID-19. but cost sharing for certain services for COVID-19 might be different under Medicare Advantage versus original Medicare. They have to ensure access to benefits provided at non-contracted facilities when that's necessary. So that's a little different. Usually you can only go to a contracted facility, but due to the emergency, there are cases where, you know, they have to provide access to non-contracted facilities and waive in full requirements for gatekeeper referrals in some situations. And when they do that, they have to provide the same cost sharing for the enrollee as if the service benefit had been furnished at a contracted facility. So there's some situations right now due to the emergency where someone would be able to go outside of the network of their Medicare Advantage plan for services and would not have to pay a higher cost. But important to check with the plan, you know, if you know that's something you're going to take advantage of. There are also flexibilities for the plans to waive certain cost sharing, as I mentioned, that they aren't required to waive, and paperwork requirement for medications, particularly prior authorizations for certain medications because of the emergency. They make it harder for folks to have their physician complete that paperwork, et cetera, or work through their pharmacy. Some additional resources I did want to mention. We have a toolkit. It's really a detailed, we call it a toolkit. It's a very detailed listing of a lot of the flexibilities that we're offering related to COVID-19 coverage under Medicare. And it is broken down by different types of clinicians on there. It also has information about regular calls that we have for our partners who have billing and other issues and coverage relating to some of the flexibilities that we're providing. So questions, for example, about telehealth services, what's covered, or skilled nursing facility services, et cetera. We have beneficiary information on what is available to beneficiaries, such as information about the special enrollment periods, about their cost sharing, et cetera, on the Medicare website. And we have guidance for the health plans in terms of what their requirements are also. And as I mentioned earlier, we have the Social Security office locator, which helps you get in touch with the staff from your local Social Security office if you need their help, because the offices themselves are physically closed, but those staff are still working at home and they can help you if you need to talk to a person. But many of the things you may need to do in terms of handling your enrollment in Social Security benefits, whether it's Medicare or your retirement benefits, you may be able to do you know, just by using the resources on their website. And I should mention, they have, just like we do, they have a COVID page with detailed information. Earlier in the slide presentation, I know I included a link for detailed information on if someone doesn't want to or is not able to apply online for some reason, maybe it's a glitch or something, and so they want to use mail or fax. They're really good, detailed instructions. It has the forms that you would need to download and print, et cetera, in order to do that. So that's all on their website. And if folks, we'll take a couple questions, but if folks want to follow up with me, if you need, we're happy to do, of course, online presentations just like this one. That's the core of my work is outreach and education. So feel free to send me a note, but also if you have any questions that come up about our programs where you need our help, please feel free to reach out to me via email. My email is on this closing slide. And thanks everyone for your time and attention. And I guess I'll see if there are any questions.
So Frank, this is Melissa. We're gonna go ahead and switch to Charles before we take questions for the both of you, because I feel like we'll probably have some where the two of you can answer questions together, because you're going to probably get some similar questions. I know we did have some questions already in the chat box that were specifically for Frank, but we are going to hold those just for a minute or two while we let Charles give his presentation, and then we will do a Q&A, I promise, and we'll get all your questions answered. I know some of the questions in the box had to do with the slides, and yes, our follow-up email to everyone after the webinar will include a recording of this webinar, as well as the slides and any additional materials that the panelists would like to share with you all. So with that, I'm going to turn it over to Charles to give his presentation. So Charles, if you wouldn't mind unmuting yourself and go ahead and start your presentation.
Okay, thank you, Melissa. Again, my name is Charles Clarkson. I am the project director of the Senior Medicare Patrol of New Jersey. And for those of you who don't know who we are, basically every state has a Senior Medicare Patrol, and we are funded by the Administration for Community Living, which is part of Health and Human Services. But before I get started, I wanted to thank, obviously, AARP and the Archer Law Practice, as well as the New Jersey Foundation for Aging, for allowing me to be a panelist. Obviously, we're trying to reach out during this COVID-19 crisis, and these Zoom meetings are quite essential. So I want to just give a quick overview that, just because we're in a COVID-19 crisis, you can't let your guard down when you're fighting Medicare fraud, waste, and abuse. As a matter of fact, you have to be more of an advocate for yourself and be more careful. So I'm just going to go into a couple of overviews about Medicare fraud, and then I'm going to switch to what we're seeing because of the COVID-19 crisis. You'll notice I don't have a PowerPoint, but my picture is up there with our SMP logo, and we will be happy to take questions at the end. And of course, if you need to reach me, you could always email me at my office site, which is Charles, the letter C, at JFS, which is Joy Frank Sam, Middlesex.org, because we are housed at the Jewish Family Services in Middlesex County. And of course, you could always call us at 732-777-1940 and ask for the Senior Medicare Patrol Project. Obviously, we are working from home at the moment, but our offices are technically open, and we are still accepting phone calls, and we are still investigating and helping seniors review their Medicare statements so they are not being cheated from fraud, waste, and abuse. So, we recommend that people basically protect their Medicare cards. I know that a year ago, or actually 2 years ago when it first started, Medicare started issuing new Medicare cards with basically removed the Social Security number and added a randomly generated numbers and letters, some of which, cannot be on there, like zeros. So, but I just wanted people to realize that that Medicare card, even though they got a new one with a new number, is still quite valuable. You still have to protect it, just like you would protect your Social Security card. If someone took my Medicare card and went to a doctor and they weren't careful about IDs, well, then that person could basically say they're me and basically get free services, which would be charged to my personal account. And then when I needed the service and I got it and then Medicare refused payment, then I saw the statement and would say, well, you already have this payment or this service within the last year, and therefore we're not covering it again. And that's how a lot of people find out that they're being cheated, because someone is using their Medicare card improperly. So a couple of things that we want to stress before we get into COVID-19. Number one, always protect your card, like I said. Number two, you must read your Medicare summary notices. It's very, very improbable that you will be able to discover your fraud unless you read your Medicare summary notice very, very carefully. Now, if you're in a Medicare Advantage plan, you should always read your explanation of benefits, which usually is the statement you get from a Part C plan. So because I usually almost guarantee people that if they don't read their Medicare summary notices, then they're going to be cheated at one time or another. Not because it's always intentional fraud, but mistakes happen all the time. And we at the SMP see a lot of improper billing, mistakes, wrong codes put on billing. So read the Medicare summary notice very, very carefully. Even if you're not sure that you're being cheated or you don't know why you're being billed for these things, let us help. We are free. We're not selling anything. All we want to do is give you advice about protecting yourself from Medicare fraud, waste, and abuse. Now, I'm going to go into by the way, just to give people an insight on what the 3 top Medicare frauds are. Well, some of the more common Medicare frauds. Obviously, number 1 is billing for services never provided. Again, why you must read your Medicare summary notice to make sure that you're not being billed for other tests or services that you know you didn't get. I mean, I had a woman once who said to me that her doctor was cheating Medicare because they kept adding a service every time she went for a test that she knew she didn't get because she kept accurate records. And I said to her, okay, fine, give me the name and address of the doctor and we'll look into this. And she said to me, surprisingly, well, I can't do that. I don't want to get him in trouble. You know, Medicare spends we lose $60 billion to fraud, waste, and abuse every year. So this is your money. It's coming out of your tax dollars. So please help us fight Medicare fraud. If you suspect you've been cheated, call us. Let us know. Even if you're not sure, call us. Let us know. We are experts in this field and we can help you. So, and the second, of course, is upcoding. You know, a doctor basically gives you a service, but when they bill Medicare, they put in a service code which is higher than the one that you've gotten. I'll give you an example. I fall, I hurt my wrist is swollen. I go to my doctor and he says, Charles, I think your wrist is broken, but please go and get an x-ray because I really can't tell through the swelling. I get my x-ray, but when I see my statement and I look at my Medicare summary notice, they didn't bill for an x-ray, they billed for a CAT scan, a much higher payment code. So please always read your Medicare summary. Make sure you're getting the right service and the right billing codes. And of course, double billing. We see a number of double billings where a Medicare beneficiary gets billed and then a month later they might get billed again. Now, we don't know whether it's fraud, whether it's just a mistake. Again, you have to read your Medicare summary notice to make sure you're not being double billed. So that's in general how to protect yourself. Now, I really want to talk about what else you can do. And even though there's a virus out there, there are some basic steps that we recommend all the time. And one of the more important ones is please hang up on all robocalls. You know, even during the Corona-19 virus, most solicitations and scams are being conducted either by text, but more importantly, by phone. So if you haven't done so, I would highly recommend that you go out and get a message machine with a panel that you can see the number that's calling you. If you don't recognize the number, then don't pick up the phone. And what you're going to find is that most people don't leave messages. So you know it's a solicitation, and you know you were probably going to be either be sold something or be scammed. So you basically erase the possibility of that by not answering the call. And remember, the more you answer your calls, even if you don't recognize the number, the more you answer the calls, the more calls you're likely to get. So please get a message machine and make the message machine screen all your calls. And as I say to my wife, you know, I don't even pick up my sister-in-law's calls because I do recognize the number and I don't want to talk to her. So you can use it for both. But it's important to get a message machine. Now remember, the number that shows up on the message machine may not be the correct number. Even though it says Social Security with a number, that may not be the Social Security number. And of course, Medicare and Social Security do not call people. So if they don't leave a message, fine. If they leave a message and leave you a number, check the number out first. Make sure the number is legitimate, because they can spoof any telephone number on there. So if you think you're getting a call because you called Social Security first or Medicare first and they're returning with an answer, don't look at the number on the screen. Look up the Medicare number, look up the Social Security number, and use that number. So what's happening during the Corona-19 medical emergency? Well, we're seeing obviously a huge uptick in fraud in these areas. Some of them basically are similar to regular Medicare fraud, but now they have a COVID-19 twist. So I'm going to go over a number of things that we have seen in New Jersey and nationally, which can help you prevent yourself from being scammed. Now, right now, we know there are no vaccinations, as Frank said. There's no vaccination, and there are no home test kits that you should be using. So if you get any solicitations about that, or go online and you see something's about cures or herbs that can help you, be aware that these are mostly scams. And they're trying to get you your Medicare number so they can improperly bill Medicare, or basically sell you services that you don't need. I've already talked about hanging up on the robocalls during the COVID-19 crisis. It may be more important now than ever, because remember, seniors have been stuck at home for a long time, maybe 3 months, and it's probably going to go on 4 or 5 or even 6, and who knows how long. So they're isolated, they're lonely, they might be frail, they might have dementia. They're going to pick up the phone. And we're trying to encourage people not to pick up the phone because of that reason. And seniors are a vulnerable population. As Frank said, during this time period, Medicare recipients are over the age of 65 in most cases, or they might have some other disabilities that put them on Medicare. So they are a high-risk group, and we want to prevent them from being scammed. Now, one important thing that I want to mention is phishing scams. You know, if you open up your email and you see an email from the CDC, which is the Centers for Disease Control, be very, very careful. I would recommend that if you're not expecting anything from an organization that you've never heard of or didn't talk to, don't even click on the link, because who knows what could be in that phishing email, because they're trying to get personal information from you. We're also seeing door-to-door solicitations for COVID-19, such as test kits or cures and things like that. So again, we always recommend, you know, don't let people into your house. You know, look through the peephole, see who it is outside. If you don't know that person and they're not properly identified, then don't talk to them. Don't even open the door, because this is just going to lead to real problems. We've seen a lot of scams with charities for the COVID-19 crisis. So we understand that people are generous and they have kind hearts and they want to give money to help the COVID-19 medical emergency, but check out the charity before you do so. If you get an email from a charity, look it up. Make sure it's legitimate. Make sure it's a real charity, because a lot of people can say they're a charity and not be a charity. And you can check out charities. If you go to the Federal Trade Commission, you can go to ftc.gov/charity and check out whether the charity is legitimate. We want to make sure that the money is going to the right place to help people in need. We also have seen, and this is really insidious, we have seen false testing sites. People have pulled over in large vans or semi-trailers, put up signs saying free COVID-19 testing. Don't get scammed by these. We had a case where we saw people wearing construction clothing and not PPE or personal protective equipment. So that's a dead giveaway that these sites may not be legitimate. If you think you've had COVID-19 or you want to be tested and it's available, look up the testing sites online, go to your browser, and get the legitimate testing sites. You might even want to call ahead to make sure that You don't have to meet certain qualifications in order to get the testing sites. So, you know, there are a lot of scams going on now related to COVID-19. If you hear of any, you know, please call the Senior Medicare Patrol at 732-777-1940. We want to make sure everybody is protected during this crisis. And Frank mentioned one that I want to talk about. He talked about telehealth services. Now, obviously, telehealth is working very well. There's been a large uptick in the number of people using telehealth services because especially seniors who might be stuck at home, you know, they can't get out to the doctor, or to get out could pose risk to them. So they're calling their doctor's office and getting telehealth services. But remember, there are fraudsters out there who want to take advantage of telehealth services. So again, if you get an email from doctor's offices offering telehealth services and you've never seen these doctors or practices before, don't fall for this. If you get a call from somebody saying that we'll be offering telehealth services to you, don't fall for it, okay? Go to your regular doctor, make sure that he basically understands it's you, and then let him offer you the services because that doctor is someone you know and trust. Now, again, I just want to mention that we also have obviously materials that we're handing out during this crisis. This one here is our fraud brochure. It's a double-sided 3-page panel brochure, which most people would recognize. We can send this out to programs. Just let us know and we can mail them. We just had new ones printed. It's got the Medicare card on the bottom, which shows, and our hotline number as well as our regular telephone number. We also have some Medicare alerts that are out there that we can send to you that you can hand out. You know, just because you're living in a senior residence and you can't go out doesn't mean you can't be educated. We have sent out to social workers out these buildings some of these alerts and asking them to send it under their doors or put it under their doors or hand it out to their residents, because it's very, very important that the more we know about these scams, the more protected we'll be. So again, just to mention, the Senior Medicare Patrol in New Jersey, our telephone number is 732-777-1940. Our hotline is 877-SMP, that's Sam, Mary, Peter, 4359. And also, please visit our website. We've posted a lot of these, my fraud brochure, and we posted the alerts on our website. And our website is www.seniormedicarepatrolnj.org. Again, www.seniormedicarepatrol.org. No caps, no periods between seniormedicarepatrolnj.org. And again, that's on our brochure. So I want to thank everybody who has joined this Zoom conference, and want to say we're available to you. If you belong to a housing residence or group and you'd like to have a Zoom presentation, so we have a Zoom account, and we would be happy to set up a meeting for you. We'll set up the invitation for you. We'll attach alerts and the fraud brochure so you can email it to your list or give us the list, and we will be happy to email it to you. You know, let's not use the coronavirus emergency as an excuse for not getting the word out. We can get the word out. It's just going to take a little more work. So thank you again very, very much. And please call us if you need us. Melissa?
Thank you, Charles. That was excellent. So happy to have you share that information. I just want to assure our audience that while some of the things Charles says may sound scary and harsh, it's very important and necessary to know how to protect yourself and to know how to protect your family members, your loved ones, and the clients and consumers that you work with. So we're appreciative of the information that you've been able to share with us today, Charles. And so we do want to take some time to take some questions from the chat box for both Frank and Charles. As I said, and I know during Frank's presentation, some questions were coming in to the chat box that particularly had to do with Medicare coverage. And so Sue, if you're there, Sue, the communications manager at NJFA, is here with us to help manage the chat box. So Sue, if you have some of those questions ready, could we go ahead and pose those to Frank and see if we can get some answers for folks?
Absolutely, and here we go. Frank, the first one has to do with about penalties. So it's a multi-part question. How are folks penalized if they do not sign up at 65? Are they penalized for both A and B if they do not sign up? And how are folks penalized if they do not sign up for Part D? Sometimes folks are now using special like GoodRx cards that are out now.
Yeah. The discount cards don't protect you from penalties for signing up late for Medicare Part D. Only what's considered to be creditable coverage, so coverage is considered to be as good as Medicare's coverage. In most cases, that would be an employer drug plan. VA, if you actually you have to be signed up for VA drug benefits in order to protect you from the penalty for signing up late for Part D. Part A and Part B are different. With Part B, which is the one that really affects most people, we basically count coverage through your employment, your current employment, or your spouse's. So once you retire, your retiree coverage from your employer does not count. It has to be through current employment, and things like COBRA don't count. We don't really care how good the coverage is. Like with Part D, we care whether it's creditable. With Part A and Part B, we care where it comes from. So if it comes from your employer, your current employment, or your spouse's current employment, then it protects you from that penalty. Now, the penalty rarely takes place. There is a penalty for signing up late for Part A. It only applies if you have 10 years of work credit. So, you know, for most people, they get Part A without a premium because they've worked and paid Social Security taxes for 10 years. If you don't meet those requirements and you have to pay a Part A premium, then if you sign up late for Part A, you would actually be penalized as well. And Part A and B usually is 10% a year. That you're late for Part D, it's 1% a month. And I saw a question there relating to Medicaid. You know, if you have Medicaid, you're going to have to sign up for Medicare to get your drug benefits because those who are eligible for Medicare and Medicaid, you're going to get your drug benefits through Medicare Part D. So, you know, eligible for Medicaid, when you turn 65, you're going to have to sort of change to a different type of Medicaid that looks at different things in terms of your eligibility than when you're between the ages of 18 and 64. But you know, you are going to have to get Medicare. The good news is you should ask about the Medicare savings programs because Medicare, your Medicare premium can and should be picked up if you're eligible for Medicare and Medicaid. And there's some people who would qualify for that also, whose income might be a little too high for them to get Medicaid.
Thank you. And Frank, does active pre-65 enrollment in Medicaid act as a substitute for Medicare Part B? If so, does the MA recipient have to do anything to assure continuity of benefits?
No, it's not a substitute. Now, when you turn 65, there is sort of a reset on the penalty. So if you didn't sign up for Medicare and you were eligible for Medicaid and Medicare under the age of 65, you know, there's kind of a reset on the penalty when you turn 65. It's what we call a new entitlement. So the penalty wouldn't carry over if you decided, I don't want to sign up for Medicare Part B at under 65, but usually you get that Part B premium paid for by Medicaid. So, you know, that's something you'd want to talk with your Medicaid office about, you know, if you're under 65 and you're eligible for Medicare based on end-stage renal disease or disability.
Thank you. Is there still a limit on OT, PT, and speech therapy?
There's not a hard limit on those anymore. That was lifted. After a certain point, those services will be under medical review, but there's not a cap anymore.
Okay. And how many COVID-19 tests per year will Medicare cover?
Okay, so I was waiting to get to this one. It's a good question. Right now there's no limit. Essentially, I think what's going to happen is, and it's possible it's happened already, is when services are new, a lot of times our Medicare administrative contractors set limits that are, again, not hard limits. We talked about that in the context of physical therapy, occupational therapy, that there may be sort of a point at which medical review is required. So at a certain point, you have more than a certain number of tests, that may be reviewed. It's also possible there's some talk about setting hard limits, or they could be, again, softer limits where it's based on medical review. Because one of the concerns is really, there certainly are some Medicare folks we talked about who might still be working. And there's talk that some employers might want to test their employees on a regular basis to make sure that they're safe to come back and work. So there's a lot of debate. Well, should, Medicare or private health insurers, if they have private health insurance, or Medicaid, be paying for those tests, or should the employers be paying for them? So there's some debate about that. We really don't know in terms of, if there will be a policy change that might say, sorry, you can't get that, because it is a little unique. Our stance right now is that you can get an antibody test. You also can get a COVID-19 test. There's not the strict requirements about symptoms that we would usually have. So we're almost treating it sort of in between what's considered a preventive test and a diagnostic test. But I think if there's widespread testing required by employers, I think both the private insurance companies and Medicare and Medicaid will have some concerns about that at some point. So there may be limits in the future. Right now, there are not.
Okay. And during the yearly enrollment period from October to December 7th, if you do not want to make any changes to your current plans, do you still need to do anything during this period?
No, you don't have to. We have a lot of time on our hands these days, though, being stuck at home. So it's a great time to go to the, if we're still at home in October, use the Medicare website, look around, see what's available. You don't have to take action, but we do encourage people to review their options each year, because even if your needs don't change, which in many cases they do, because maybe you have new prescriptions or different doctors you're seeing, et cetera, your plan's going to change from year to year in terms of what it covers and what the costs are. So we encourage people to do that review each year. 1-800-Medicare will be there to help. The website and also the state health insurance assistance programs, they're going to probably provide a lot of help over the phone. So there are a lot of resources people, if they want to take advantage of that enrollment period and review their coverage, they can. But you don't have to if you don't want to. And generally we'll roll you into the same plan next year. There are occasionally plans that leave the Medicare program for business reasons. Then we usually will try and shift you into another plan. But obviously, if that kind of thing happens, you need to look out for mail from your plan and the Medicare program if you need to take action. And then you might get a special enrollment period also, so you get a little extra time to make a decision. I want to mention, I also saw in the chat box there was a question about New Jersey Medicaid telemedicine provisions. I will share a link with Melissa that can be shared to the group, and then you all have my email, so I know sometimes they're in the weeds questions. Feel free to, the person who posed that, to send me an email, and I can send it to our Medicaid staff to forward to the state of New Jersey. But hopefully the general resource will answer your questions. If not, feel free to shoot me an email.
Yeah. So just quickly, as Melissa, again, I want to jump in and say, Frank, that I appreciate you mentioning the SHIP program as a resource for open enrollment and letting people know that there is the Medicare Compare option. I wanted to ask Charles if he wanted to weigh in at all about open enrollment and provide any additional details, because I know that SMP also does help folks who are looking to understand open enrollment and make their decisions. So.
Yes, thank you, Melissa. Yeah, I just wanted to let people know that even though I'm more of an expert in Medicare fraud, I'm also a SHIP counselor, certified, got a certificate of appreciation. And every year, Frank said, you should review and look at your options. And we want to be a little stronger than that. Definitely look at your options, because we have seen a lot of, issues where people who do not change their Part D plans, they get on new medications and now they're paying a lot more money, and they didn't take the time basically to review their Part D prescription drug plan under the Medicare Plan Finder. Now, I know using the Medicare Plan Finder can be a little difficult, but the SMP is here to help, the SHIP program is here to help. I mean, I know every year I sit down with dozens of people and review their Part D prescription drug plans, and I am shocked how often I have to change plans because, $1,000 here and $1,000 there can make a big difference for someone who's just living on Social Security and is taking a lot of medications. So review your drug plans every year. And if you haven't done so yet, also open a My Medicare account. You can go to the Medicare website, which is medicare.gov. You can open a My Medicare account. You have a password. And then you don't have to wait 3 months to get your Medicare summary notice. You can look on it online and get a head start on whether or not you're being cheated, because you can look at your statements right online as soon as they're posted, which usually takes, Frank, about a week, maybe 5 to 7 days to post things. So I find that invaluable. I know I opened accounts for myself and my wife, and I've also opened my Social Security accounts for myself and my wife, even my daughter and my other son. So these online sites really are an efficient way to get information and to see what you're being billed and whether you're being cheated or not.
Yeah, I think those are all. Yeah.
I was just gonna say it's a great time to do it. Some of us, there are lots of things we do during this, time of staying at home. But I know one of the things I've tried to get a little bit more organized and done some things that, didn't have time to do. Well, that's just a few minutes, but now you have the time, open the accounts, and then you can keep track of everything a little bit better. It's going to pay off for years to come if you do it.
That's great. I thank you both for providing such great information, and we do want to switch in a minute to Christine to give her presentation. But before we go, I know we're not going anywhere yet. Before we do that, I did want to ask one more question to Charles that I did see in the chat box. And if your question hasn't been answered yet, I promise we'll try to get to it at the final Q&A. And if we don't, we can always follow up in an email with you if we don't get to all the questions. Sue, I know there are a lot of other questions there, but one that I'm just going to jump to quickly for Charles before we go to Christine is the question that came in regarding what SMP's abilities are to stop fraud. So I believe the question had to do with if someone reports fraud to a doctor, what is SMP allowed to do? What are your powers in a sense to fix that issue? So Charles, if you could talk to that a little bit before we jump to Christine.
Sure, thank you very much. Yes, we're not police, we don't carry guns, but we work closely with the Office of the Inspector General, the OIG. We also work closely with the U.S. Attorney's Office out of Newark, New Jersey. We have a FBI agent on our advisory committee that consults with us. Melissa is on our advisory committee also. So yes, what we usually do is we will get the complaint, we will get the Medicare summary notices, we will review the facts, we may even speak to the doctor's office, and we will try to make an initial determination whether there's Medicare fraud. Now, if it's outright fraud and not just a billing mistake, we basically have a database, and we would enter all that information into the database, and then we make a formal referral to the Office of the Inspector General, and they take it from there. But if it's just a question of being improperly billed and maybe not a consistent pattern of fraud, we have anywhere from 30 to 40 volunteers, and we assign a volunteer to the Medicare beneficiary who files a complaint, and that volunteer's job is to get all the facts, review all the documentation, try to get the money back either to Medicare or to the beneficiary paid out of pocket. And we've been pretty successful. Last year we did a genetic testing fraud case which we had brought, and we recovered $2.3 million for the Medicare Trust Fund. So please let us know. This is what we do. This is what we like to do.
Yeah.
I have a couple of volunteers who are doctors and the best thing they like to do is go after doctors.
Yeah, right. Yeah, they want to catch the folks that are giving the rest of their profession a bad name, right? So
That's right.
yeah, no, as Charles said earlier on in his remarks, SMP is a national program. He runs the New Jersey program here, but this is a national program that has connections with the Medicare office directly with law enforcement, both locally and at the federal level. And so they do make reports of things to help recover that money on behalf of Medicare. And so it's great work that they're doing, and we're happy to have you. I did want to also let you know that, as I said earlier, in the follow-up email, we'll be providing information. And so some of the things that Charles showed you in physical copy that he has there with him, we will be sharing links to receive that information electronically, as well as a way to sign up for Charles's alerts and information in our follow-up. So thank you both, Frank and Charles. If you'd hang out for a minute, and then if folks have more questions for you after Christine's presentation, we can take a little bit more time to talk about this stuff. But as I said, if we don't get to everyone's questions before the end of today, we will provide follow-up so that you can get your questions answered. And with that, I will turn it over to our friend Christine Newman at AARP New Jersey. So Christine, go ahead and take it away.
Good morning. Thank you, Melissa. Can you just give me a confirmation that you can see my slide deck okay?
I can see your slide deck. It looks great.
Perfect. So thank you so much for inviting me to participate in this conversation. I have learned so much already from listening to what Frank and Charles have shared. And I think for all of us, these learnings can apply directly to a specific group, which is our family caregivers, especially in the time of COVID-19. I mean, our world has fundamentally changed what seems like overnight, and particularly family caregivers are facing some unique challenges right now. You know, they're worried about caring for their loved ones and their spouse, but now having to do that maybe in times of isolation or social distancing. You know, also worrying about income, right, in the midst of layoffs or furloughs, and then additionally just wanting to keep themselves and their loved ones safe. So today I'm going to focus on 4 key areas that include how advocacy and education, as well as legislation and resources, are all helping family caregivers navigate through some of these uncharted waters. So we're going to be talking a little bit about earned paid sick leave here in New Jersey. I'm also going to touch on expanded access to telehealth services here in New Jersey specifically, and how that is impacting caregivers. Also, what are questions to be asking if your loved one is in a long-term care facility, and also the importance of making sure you have a caregiving plan. I think in particular with COVID-19, this situation has really highlighted the importance of and how critical it is to have a plan, and have a plan before a time of crisis or emergency. So we're going to walk through what are some of the key elements that you should have in that. So caregiving is maybe the most important role any of us could or potentially will take on in our life. And I think just to get started, I wanted to get a sense of who we have on the webinar today. So if folks can just put in the chat for me, I'm curious to know, you know, have you ever been a caregiver? Are you a caregiver currently, or do you anticipate being a caregiver in the future? I just want to kind of get a sense for the crowd we have. Typically, we know I got a yes to all. Has been a caregiver, anticipates. Yeah. So it looks like a lot of us who are on this are either currently in this role, have been in it for a while, or do anticipate it. And, you know, here in New Jersey, we have over 1.1 million unpaid family caregivers. And that number may actually be underrepresented, because a lot of times folks don't necessarily relate to being a caregiver, because they just say, well, I'm just being a good daughter, right? I'm just being a good friend. I'm just taking care of my family like you would do normally. So for AARP, caregiving is in our DNA. We've been supporting family caregivers and their loved ones, both directly through programs, online resources, and more indirectly through our state and federal advocacy work as well. And we're going to start the discussion today in that area of advocacy for caregivers and the implications specifically during the COVID-19 crisis. So here in New Jersey, and a major focus over the last several years of our advocacy work has been expanding access to earned paid sick leave for those 1.1 million family caregivers. The average caregiver in New Jersey is a 42-year-old female who is still working outside the home at least part-time. We know many family caregivers are juggling not just part-time work, but full-time work and their caregiving duties as well. And caregivers shouldn't have that added financial stress about worrying about missing a day's wage versus maybe taking a loved one to a doctor's visit that's needed. Additionally, in the case of COVID-19, caregivers should be able to stay home when they're sick without the burden of worrying about missing that day of pay to take care of themselves or to take care of a loved one who might be sick through this crisis. So prior to the pandemic here in New Jersey, we already had access to paid sick days through our earned paid sick leave legislation that went into effect in October of 2018. So this law allows New Jersey employees to earn up to 40 hours of paid sick leave a year. So it's basically 1 hour for every 30 hours work. And that's regardless of the size of the employer, and it applies to full-time and part-time employees. This time can be used to care for yourself, and it can also be used to care for a loved one. Since the COVID-19 crisis, this has actually been expanded in the states. The program was expanded so that you can now use paid sick time if you or a loved one that you're caring for is required to be in isolation or quarantine. And you can also now use New Jersey's earned paid sick leave to take care of children in the event of school closures. So we talked a little bit about telehealth services. AARP has been engaged in advocacy around this for several years. Even prior to the pandemic, we've really been advocating for improved access to these services because we know how helpful they can be, specifically for family caregivers and for their loved ones. Not having to maybe take time off of work or leave to travel long distance, but to just have that convenience of being able to have that visit in the home or remotely can have great impacts for our caregivers. And I'm also curious about this because I know, we have seen great expansion in the last several months in telehealth utilization and access here in New Jersey. So I'm just curious, and if you can tell me in the chat box, if you or someone you're caring for has taken advantage of telehealth services. And I'm curious to know if it was your first time doing it, like during this pandemic, or have you done this already? I actually utilized telehealth for the first time because one of my regular doctors was closed. And I mean, it was a game changer for me where I would have usually had to have taken half a day off of work. Now I was able to do that during lunch. I see a lot of people actually saying, yes, it was their first time during this pandemic. Yep. And then a couple folks who said they've been using it for a while, but definitely in New Jersey, we've been focused on this for several years. I want to just make sure everyone kind of has a baseline understanding of what we're talking about when we're talking about telehealth. So really we're saying, using digital information and technologies such as computers, mobile devices or apps to manage either your or your loved one's well-being. And that can now be done over distances. So while usually we think of telehealth services as clinical services, they also cover things that are a little broader than that. So patient education can be done on telehealth, provider consultations, and things like home monitoring also fall into this telehealth realm. So telehealth isn't necessarily a unique medical service, but really it's an innovative way that care can be delivered. Another added benefit is, of course, the ability to loop in family caregivers. So with a patient's consent and doctor's consent, a caregiver who may live really far away or just can't get off of work for whatever reason for that day can join that visit virtually. And a lot of times it can be really helpful to have another set of eyes and ears in that conversation with the provider. And it's also for caregivers then helpful to keep track of their loved one's health situation. So AARP really sees this as a promising tool to help people access healthcare in new ways and make it easier for family caregivers to care for their loved ones. More of our members, especially those aged 50 to 59, are using their mobile devices tablets on a very frequent basis. So one of our focuses is making sure that this continues to be a priority moving forward out of this pandemic. So here in New Jersey, we had started to move slowly towards allowing the use of telehealth. Some providers were practicing telehealth already. In 2017, New Jersey passed a law that did allow more providers to engage in telehealth. And that law gave a new definition of telehealth so that we were all kind of working off of the same standard definition of what that is. In response to the pandemic, many states, including New Jersey, have moved quickly to increase access to telehealth. So Governor Murphy enacted a law allowing out-of-state providers to now provide telehealth services in New Jersey for coronavirus-related issues only. He also enacted an order which requires Medicaid and private health insurers to provide coverage for telemedicine services during the state of emergency. And so this also covered things like parity, and parity talks about if you're an insurer getting reimbursed at the same rate, if you're a provider getting reimbursed at the same rate, if you're doing this in person or virtually. So parity was addressed with this as well. Our focus moving forward is going to be on how do we make these these temporary expansions permanent. Another key area for us in this space is going to be around expanding broadband. So there are still parts in our state where folks don't have access to reliable internet service, and that underlying infrastructure for broadband just isn't there. And it's absolutely critical, especially in a situation like this where telemedicine may be the best option for folks to engage and still get the care they need. And for caregivers to be able to stay involved in that, we've got to make sure that folks still have access to broadband. Another area that my organization has been laser focused on during this pandemic is the crisis that has unfolded in our long-term care communities. Too many nursing home residents and staff have died from COVID-19. So ensuring safety and transparency in our nursing homes and in our long-term care facilities needs to be a priority, not just now, but also as we move forward. So AARP has been advocating at both the state and the federal level to ensure transparent reporting from our communities, ensuring communication is open, active, and frequent between facility and family members, addressing things like virtual visitations. Do these communities have adequate personal protective equipment and testing? And then specifically staffing. Do our staffing levels where they need to be for direct line workers and also supportive roles like housekeeping, dietary? So based on what we've seen play out in our long-term care communities during this crisis, AARP has actually developed a list of 6 key questions that if you have a loved one in a long-term care community or you're thinking you may need that level of care, these are questions that we would recommend everyone ask before making the decision, or if you already have a loved one who's in one of these settings. So has anyone in the nursing home tested positive? What's the nursing home doing to prevent infection? What are their infection control protocols and policies? And then what things have they maybe changed or tried new since COVID-19 to deal with the pandemic? Does the nursing home staff have the PPE they need on each shift? What are they doing to help residents stay connected with families and loved ones? Do they have staff that are working with residents to help facilitate virtual visitations? Things like Skype meetings, Zooms with family. And then what is the nursing home doing to communicate information regularly and consistently to residents and families? So really that piece on transparency. And then lastly, is the nursing home at full staffing levels? And again, I'd say on this one, it would be important to talk about, of course, frontline nursing, but also get a good sense of what about other departments like housekeeping, dietary, that are so critical when we think about community infection. And if you do have a loved one in a long-term care community and you have concerns for their safety, I do want to make sure everyone knows that the New Jersey Long-Term Care Ombudsman you can reach out to that individual. You can call the hotline number that's listed here, or this is the email address as well. And then AARP has a specific designated landing page that we've designed. It's this aarp.org/nursing homes, where you can find information like what I just shared that we've been putting together, tips, resources, and information for caregivers who have loved ones in these communities. And lastly, more than ever, I think now, if you're a caregiver, this need to make sure you have an established plan of care is absolutely critical. When I asked earlier how many folks were new caregivers or have been on this journey for a while, really no matter where you are in that process, making sure that you have a plan that's simple, realistic, is really critical and can really help make sure that in times of crisis, you're not trying to put all of those pieces together, because that can just be really overwhelming. So a good way to approach this concept, because sometimes I know you think about like creating a plan, oh my gosh, there's so much that could go into that. So how do you kind of take that and break it down into pieces? This is a process that AARP has developed, and we have a caregiver resource guide that actually everyone who's participating today is going to get a copy, a PDF copy, as well as a link to where you can download these guides if you're also someone who maybe works with other groups and you want to share these out. They're free to download. You can also order them to have hard copies shipped. But really, we're going to kind of talk about creating this plan in 5 areas: starting a conversation, forming a team, making the plan, and then really also looking at where we maybe need to find additional support and care for the caregiver. So if you kind of break it up into these areas and chunk it out a little bit, sometimes that can be a little easier than thinking, oh my gosh, I have to put together a plan, and just not really knowing where to start from. So really, step 1 is, how do you engage in that initial conversation? And a lot of times families avoid these discussions about the future simply because they don't want to think about changes in the lives of the people that they love the most. Again, many people unfortunately wait until a crisis before they talk about things like, what's my loved one's values and preferences? What are their wishes for healthcare? What are details around finances? And it's never easy to bring up what you think might be an uncomfortable topic. However, a lot of uncertainty can be avoided if you talk with your loved one before a crisis occurs. So sometimes really the hardest part can just be broaching the topic to begin with. So things like looking for an opening, when you're trying to raise the topic of future care, you might find it helpful to reference maybe an article you just read or something you saw on the news to break the ice. So something like, I'm starting to think about my own estate planning. Do you have any advice? This is not really about anticipating what your loved one might say or how they will react. It's just about, how do you get that conversation started initially? And most importantly, listening, keeping in mind that this conversation is a starting point, and it'll take time to fully develop. Respect your loved one's wishes. Make sure your loved one is participating in the conversation as much as possible. I really think that is like the key critical component to a successful caregiving plan. It's important that that whole plan really centers around the wishes of the person who's receiving that care. Where do they want to live? How do they want to handle their finances? And then you build the plan around those preferences. And then sizing up the situation. So once you get that conversation going, evaluate what you're hearing, understanding your loved one's priorities, where they want to live, the nature of the care they want. That's going to help you determine these next steps. And another key piece in starting this conversation is around reviewing finances. And I know that this is a point that sometimes folks get stuck on. It can be uncomfortable to talk about. Money is a particularly sensitive subject, but it is often at the heart of many decisions you'll have to make with a loved one. So you have to consider how you're going to pay for things like housing, healthcare, other expenses like groceries. So asking a loved one to review their bank account, investments, insurance coverage, and other assets really is a key part of this conversation, as you're going to need to take that information to then build a successful plan. So the next thing after that conversation is you want to start forming your team. Caring for a family member or a friend can be too big a job for one person. Trying to do everything yourself can lead to burnout, problems with your own health and well-being, and it is okay to ask for help. It's important to try to identify and form a larger network of family members and friends, and even community resources that you can tap into to help share that load. And your loved one can really help with this as well. So again, making sure that the care recipient is at the heart of that plan means they're going to be able to tell you, folks in the community, whether it's friends, neighbors, community groups that are engaged in, that might be good connections to tap into when you're putting together your team. When you are putting your team together, things to look for are folks that live nearby. So proximity definitely has its advantages. If it's someone just down the road, it's easier for them to just stop over really quickly to pop in to see and do a check-in, take someone to a doctor's appointment, maybe cook a meal. But I would say also consider roles for out-of-state support as well, and especially when you're talking about situations like emergency, a crisis. Whether it's here in New Jersey, we unfortunately have had many really large storms that have impacted our area. So sometimes having someone who lives geographically further away, who maybe isn't in the same situation that's unfolding on the ground where you and your loved one is, can be really beneficial, because as the caregiver, you're trying to manage the health, well-being of your loved one, but in the state of a natural disaster. And someone who's not in that area could then step in and order groceries remotely, just something like that can kind of help. So don't discount individuals who do live further away. I think looking to have a combination of that is really good and can be a good tactic, especially when you're trying to contingency plan for an emergency. You also want to look for people that can just help with simple tasks. Don't be hesitant to ask for this help. Some people may only need a little encouragement and might actually be excited that you asked them to help. And then you also want to leverage the talents and strengths of your team. So for example, if you have someone in the family who's really computer savvy, maybe their role could be setting up an online calendar for coordinating meals or chores. Kind of thinking a little outside the box of what we typically think of as the standard supports in caregiving. What are some of those other roles that your network has some skill sets in that could help benefit the care recipient? So part of building and supporting your team is also figuring out what's that right number of people to have. So you really want to think about both quantity and quality. Having a large caregiving team can be helpful because it means more hands, light work, but there's also that expression, too many cooks in the kitchen. So, you want to make sure that it's not too large of a group that it's unmanageable. And with that, making sure everyone is very clear on what their roles and responsibilities are. Those should really try to play to individual strengths. And it needs to be very clear what's the expectation. I also think a good thing to talk about as part of that is rough time commitments, right? We anticipate needing help this many hours a week in this area. Because again, that just lets everyone sort of know that expectation up front. And again, here, focusing on the care recipient, that person needs to be at the center of this. Of course, barring any mental or physical incapacity, that person receiving the care should play a significant role in determining who's on that team. So now that we've worked on establishing the team, you move into that third phase, which is actually making the plan. The plan does not have to be extensive. It doesn't have to be fancy. We are never going to be able to think of every single possible contingency. But the first thing you want to do to get this going is you want to hold a team meeting. You want to get your folks together. And again, now we sort of have additional challenges in this COVID-19 world. So thinking about things like, could you host this initial meeting like this, through a Zoom meeting, through Skype? It doesn't necessarily have to be in person. It could even be a conference call, or Do you think doing this over email works? But after that, you want to assess the goals and needs of your plan. Again, doesn't have to be extensive or fancy. You can't anticipate every detail, but you want to include immediate needs that you know the individual has. And then also think about broader plans for the future. And when you think about these broader plans from the future, I think that's also a really good time to think about emergency planning. So as part of this, you know, if there's an emergency or a crisis that happens, what are elements of this plan that would need to shift, modify, and just start to walk through that? Again, I mentioned everyone who's on this is actually going to get a copy of our Prepare to Care guide, and a large piece of that guide, and I'll just tell you now, it's on pages 23 to 33, is an actual assessment tool and process that works through this, about how do you assess your goals, how do you assess your needs, and then how from that you start building out and delegating responsibilities to your team. And you also want to make sure your team members, you get their preferences on what their interests are and what their level of support can be too. Caring for yourself, and I know this is where, you know, I was in a caregiving role for many years, and this is absolutely the area that I fell short on, and I think a lot of us do, because it's hard, but it is imperative. If we are not taking care of ourselves, we are not going to be able to effectively care for other people. And you can't overlook the impact that caregiving has on you, your health, and your well-being. Sometimes, some ways you can care for yourself, look at technology. Again, what are some of the things that could make the caregiver's role a little easier? What are some apps you can use? You know, it's a lot easier to set up things like home delivery of meals and groceries now than it used to be. So look at some of these apps that can maybe help you coordinate care. Don't forget, if you're still working, to check with your employer and see what sort of benefits they may have or supports for family caregivers. A lot of companies are doing that now. Talk to your doctor. You want to make sure your doctor knows that you're a caregiver, and discuss ways to help manage your stress. And then you can also consult with your loved one's doctor for training, especially if you're expected to take on some complex medical tasks, which we know our caregivers are doing now. Things that we used to only see in hospitals and nursing homes 30 years ago, now we have caregivers that are doing, you know, wound care, daily IVs. So making sure that you feel comfortable and confident in that will help a lot with your own personal stress. And then taking advantage of caregiving services and supports, looking for things like support groups that are in your area, and making sure that we're all taking that critical time to take a break. Get the sleep you need, get the exercise, and staying connected with friends, which I know can be a lot more challenging in today's world. But again, how do we tap into some new technologies and ways to keep those connections going? And then the last step is, again, around finding support for you and your team. So really, you can be looking at community resources or professional help. Like if you get to the point where you realize that the scope of care needed for your loved one is beyond what you or your team can provide, it is okay to reach out for that extra help. And there's a number of ways that you can do that. Your area agencies on aging are a phenomenal resource to really connect you to a variety of services and supports around transportation, housing, meals. I cannot speak highly enough. That should be a first stop for anyone who's looking for additional support. There's also an elder care locator, and we have this in our Prepare to Care guide that you'll get as well. It's a public service of the U.S. Administration on Aging, and it connects caregivers to local services and supports. You can also look for professional help. So oftentimes, if your loved one's needs are very complex, especially when health, emotion, and financial issues all play, a trained social worker or a nurse can help you sort through things and determine what's needed. The elder care locator I mentioned is another great resource to help you find some of these professional resources as well. And then again, don't forget to look at your employee assistance programs, because a lot of employers are adding in benefits for caregivers now, because they understand that our family caregivers are the backbone of our healthcare system right now. And so taking care of employees who are caregivers is beneficial for the business. And I just wanted to highlight a few resources AARP has for family caregivers. We have a national caregiving resource center. You can see here both the website and the phone number. Again, these are all listed in our Prepare to Care guide. This really is our central hub of information and resources for caregiving. The toll-free number, you can call and get connected to local resources in your area as well. That hotline's open Monday through Friday, 7 a.m. to 11 p.m. Eastern Time. We also have here in New Jersey a dedicated landing page for New Jersey caregivers. So here's where you'll find information about the advocacy work we've done and are continuing to engage on for family caregivers, as well as New Jersey specific resources. And then again, the Prepare to Care guide that everyone will get a copy of that walks through the steps to create an effective caregiving plan and also has additional resources in that as well that I'll share with other folks. So thank you. I know we covered a lot of ground pretty quickly there, but I want to make sure we have time for questions if anyone has them. So Melissa, I'll turn it over to you and I'm happy to answer any questions.
Great, thank you, Christine. That was really wonderful, and I think just a great addition to the panel. And I know people have a lot of questions because I saw there was a lot of activity in the chat box, not only related to people responding, Christine, to your questions about their own caregiving experience, but people do have some questions for you. So Sue, if you're able to sort of sort through those and unmute yourself, could you let us know what the first question for Christine might be?
Absolutely. Christine, will telehealth over state borders be available in the future? Many folks use docs in Philly, and will that be covered? Some folks are unable to travel to docs due to medical issues.
Yeah, so I would say at this point it's to be determined, right? As of now, you know, that regulation has been opened up to allow out-of-state providers to care for New Jersey residents during this time of COVID. From our perspective, that is a priority on our advocacy work to continue to push that forward. You know, I know we've talked a lot about telehealth today, and we are very concerned as well of some of the, you know, safety and fraud concerns. But when we look at the benefit, especially for family caregivers, it is a top priority for us to see these expansions stay permanently, not just during the COVID-19 situation. So, you know, that's something we will definitely be focused on.
Okay. And there was a comment that a long-term care facility said they don't have enough people or equipment to virtually connect me with my loved one. I offered to provide equipment, but they didn't have enough staff to facilitate. I've also had many problems getting agency aid into facilities to provide care to loved ones because aides do not want to go into facilities because of personal concerns over COVID. Any comments that you can provide on that?
Yeah, I will just say, I think that you're not alone in that experience at all. And, you know, I think that is one of the major hurdles that most of our New Jersey long-term care, and I think across the country, are experiencing right now is, you know, how do you keep residents connected to family in a time when we have to stay socially distant? I think in terms of a facility saying that, you know, there maybe isn't a way to do that, I would say continued conversations with probably the social worker as your main point of contact for that. But, you know, our communities need to be figuring this out. It's unexcusable that people cannot stay connected to their loved ones. And it's about how do we think about our work in a different way, right? We've all been making this pivot, and it's a huge pivot, but how do we leverage the technologies that we do have available to make sure that is there? And I know a lot of communities are having, you know, weekly calls. Some are even doing daily calls with families. And so I think that that's a good way to make sure that continues to get elevated and escalated. It's a priority on our end as well, that we've been in conversations with the Department of Health with to say, how do we make sure that loved ones are staying connected during this time?
Thank you. And this is for the other panelists as well. If someone loses their Medicare card, can they request a new one over the phone now?
Okay, I'll take this one. Yes, you can. You can always order a card by calling the Social Security Administration. It might take you a while to get through now, but the easiest way is to open up a My Medicare account. And guess what? You can print your own Medicare card right on your printer, and hopefully you have a printer. But that's an easy way to do it. Otherwise, you'd have to wait a number of weeks to get the new card. And one of the things I wanted to say about the card also, which I did not earlier, don't carry your Medicare cards with you. People believe they have to have it with them. It's really a necessity, but it's really not. In any emergency, you're going to get treated no matter whether you have insurance, whether you have Medicare, whether you don't have any insurance. So leave the card at home, put it in a safe place, and only take it with you when you're going to the doctor or the hospital. Now, I caution people, don't hide it where you can't find it. Make sure you have it available, and remind yourself to take it with you when you're going, especially when you're going to a new doctor. If you're going to someone who's visited before, they're going to have your information. I don't have to show my card to my doctor every time I go because they already have my information. I go to my hospital, they already have all my information. So again, and you can always get them that information later if necessary. So leave it at home and don't carry it with you.
Okay. And then if you go to the hospital and only get admitted as quote unquote under observation, does that mean that you are responsible for all hospital costs?
Frank, you want to take that, or should I?
Medicare, I'm going to try and read in between the lines about what the question might be, because, so there are a couple things about, so observation is covered as, it's covered in a different service. It's considered outpatient as opposed to an inpatient service. But it's still, Medicare covered. What you would have to pay might be different. Now, if you are in observation status, generally, that means, under normal circumstances, if you are under observation for a few days, you would not qualify to then go to a skilled nursing facility to get skilled nursing facility care because of our 3-day requirement. There are some rules now where you have to be notified by the hospital that you are in observation status so that you can push if you think, you were as a caregiver or the patient feels you should be admitted as an inpatient. So that's now a part of the process, that notification, so people can advocate for themselves. But in the short term, the 3-day requirement is waived for skilled nursing facilities. So that observation status, it's still important in terms of how much you're going to have to pay, how Medicare is billed, whether it's billed as an outpatient service versus as an inpatient service. But it's not going to be a barrier if you need to get skilled nursing facility services at this time. You would, in most cases, I think you probably would be admitted if you need those type of services, but not always. And right now, it's not the barrier that it would normally be because of that, because of the emergency and essentially the temporary waiver of the 3-day requirement.
Thank you, Frank. And I think this may be the last question. When will insulin be covered under Part B, not Part D? Insulin is only covered on B if you use a pump. Anybody have an answer?
I think I'm muted. I don't believe that is changing. I know that's a source of advocacy, and we'll see if there's a change in the area. But traditionally, yes, insulin is covered under Part B if you essentially get that medication through the insulin is administered through a Medicare covered supply equipment. But if you don't use equipment in order to get like a pump to get your insulin, and it's just an injection, then it's covered under Part D.
And Frank, I have a question for you, since I read that now there's a program to help reduce the price of insulin coverage, and I know a number of health plans are signing up for that pilot program to reduce the cost. Do you have any more further information about that?
I'm sure we can have some. I know there are things we're looking at in terms of trying to get better pricing for medications and sometimes make Part B pricing available to those who have Part D, and also providing flexibility through some of the Medicare health plans so that they can lower costs and use the cost that's more advantageous to the beneficiary. So, we'd be happy to send on that information. I know we've had some releases about it.
Great. That was a great question, Charles.
I heard to a lot of people who call me, it's not really a fraud issue, but they can't afford to pay for the insulin. So when I read this release from Medicare saying that they're offering, or they're asking plans to sign up for this Medicare insulin program, I said, wow. So I sent that out to a number of people saying, hopefully next year, I think it's starting in 2021, right, Frank, if I'm not mistaken, and hopefully they'll be able to save money on their insulin for the whole year.
Yeah, I think, we'll send that out.
Yeah, that'd be great. It sounds like we have a lot of great information to share with folks in our follow-up email. So I just want to thank all three of you for joining us today and for providing such great information, and for the audience for your attention and for your great questions. Charles, just one thing quickly, in your urging people to start a My Medicare account, there was a question about where to go to do that. And I directed, and I hope I was correct, directed that individual that you want to go to Medicare.gov. And I think when you talked before about phishing and about all these things, you want to make sure you're going to the right websites. So if you go to Medicare.gov, they should see a link to create a My Medicare account. It's not a different website. You should get that only from Medicare.gov.
Right. Yeah. There is a site, Medicare.com,
Yeah,
which people have mistakenly go to. Please go to the government website, and not any other website, and sign up. And I think if you actually go to the Medicare.gov, I think in the top right corner, there's a big yellow dialog box that says, My Medicare. And I would urge people, I know a lot of people don't like to do this, but, pick a strong password.
Yeah.
Don't pick if it says only you need 8 characters, don't say 1, 2, 3, 4, 5, 6, 7, 8,
right,
or something like that.
No, and listen, as someone who frequently forgets their own passwords, there are great apps out there that are secure, where you can save your passwords protected on your phone or on somewhere else, so that you only have access to them. But it is important to have a strong password. It does help prevent fraud.
Yeah, and also I think Medicare now has an app that you can put on your thing to determine whether or not your service you want to get is covered, and has some other information on there. It's not that broad, but you can get some basic information on the Medicare app. And I know Frank probably can be a lot more detailed about that. I've only used it to help people just to determine coverage and things like that.
Yeah.
Yeah, it's called What's Covered, and that's another one where you have to be careful to make sure you're downloading the right app. But we have a lot of apps too that where essentially people can track their health using Medicare data, and which is exciting, but also there are concerns also about the data and whether it's safeguarded. The important thing to know there is, again, if you're interested in seeing what is out there in terms of those apps, go to the Medicare website, and there are links of those approved apps. So you don't get tricked into signing up for something that's not actually approved by Medicare and giving over personal information. Use the ones that are, that are linked to from the Medicare.gov website.
Right. That's great. And Christine, I think you also wanted to share something about that.
I was actually going to just chime in on this idea around passwords, and I have the same problem, Melissa. I'm constantly forgetting them with changes up. So one of the things through the Fraud Watch Network that we suggest is passphrases, because they can be easier to remember, but they can still be really tricky to break. So for an example, I love the New York Giants. I still even now love them. So something like, I love NJ Giant, where you change the S to a dollar sign or something, right? That it's still complicated, but it's easier for folks sometimes to remember that.
Yeah, no, that's a great suggestion. Actually, a couple of years ago for our TV program, Aging Insights, if you haven't been watching Aging Insights, you can find it on NJFA's website. We had a computer security guest on, and he did suggest phrases, and even if it's a lyric from a song, if it's a few words from a song and you change some of the letters to numbers or symbols, it can help you remember it while also being very secure. So that's a great suggestion. I appreciate that. And
right, but Melissa, also,
yeah.
I want to, don't use the same password for every site you go to.
Yeah, I'm
I
guilty
have,
of that, and I shouldn't do it.
I've gotten yelled at, but I have a 2-page double-sided list of every website that I visit and a separate password. I never use the same password. So I think I have like 200 passwords.
Yeah.
And people yell at me, well, what if you lose your wallet? I said, well, I keep a backup at home, and I would change all the major sites.
Right.
And by the way, I encourage people, I know I do this every 3 to 6 months, especially for your most sensitive sites, like your financial site, your checking account. Change the password.
Right.
I know it's hard, and I know it's difficult, and it's hard to keep track, but again, it's your money.
Exactly. That's great advice. And again, I thank all three of you for joining us today and for answering all of these questions and providing such great information. I want to remind our audience that we will be providing a follow-up email with the recording of the webinar, the slides that you saw today, as well as these follow-up resources like the generosity of AARP in sharing their Prepare to Care guide, which we will email out to you in that email, as well as the links to all of Charles's material and how to contact him, and the follow-up with Frank on some of the resources on the Medicare website. I think those are all really great things. So we're at time. So I do want to thank everyone for joining us. Thank our sponsors again, Archer Law Offices and AARP New Jersey for their support, and ask all of you to please stay tuned. We are going to be announcing shortly some webinars in July to bring you in this similar format with more great content. And please, fans of NJFA's annual conference, please stay tuned. We're taking the conference virtual, and we will have details for you very soon on how to register and what will be included in that. And we really hope that you'll join us in this new format, in this new way, so that we can be together. And I know in Christine's remarks in reference to finding support through the Elder Care Locator in our network at NJFA, we have a lot of great geriatric care managers and other folks who are out there, and our conference is a great way to connect with them. There will be a feature to be able to network with each other still, as I know we'll miss that in person, but I do encourage you to look for that information and join us, because you will be able to connect with all the great people in our network during that conference. So again, thank you all for joining us. You can visit our website at njfoundationforaging.org, as I said, for the TV program and for other links, and we will be sending out that follow-up email with this recording and with other things. So thank you so much again for joining us, and we hope to see you all again soon. Have a great weekend.
Melissa, you too. Have a great weekend.
Thanks, everyone.
Thank you, everyone.
Bye-bye, all.